My instructional video will be on passive range of motion of the shoulder and elbow with a patient in sitting. Passive range of motion is the motion through which a joint passes when moved entirely by an external force, such as a therapist, a caregiver, a machine, or even a patient's own unaffected upper extremity. The goal of passive range of motion is to prevent or reduce joint stiffness, pain, and edema, to maintain full range of motion, to increase circulation, to prevent deformity, adhesions, scar formation, as well as contractures. Many of the people that we would do passive range of motion on and educate them in this technique would be those who have had a stroke or a spinal cord injury or traumatic brain injury, victims of burns, those who are sedated or in a medically induced coma, those with a degenerative disease of the central nervous system such as ALS, MS, or Parkinson's, and even some of our patients who have problems with arthritis, and those who are recovering from injury or surgery when it's appropriate in their healing process and in their treatment plan. Why we would do this in sitting with some of our patients would be for if they're unable to stand unsupported, if they have deficits in dynamic standing balance or coordination, if they are a fall risk, or if they have any standing or weight-bearing precautions. Before we would begin passive range of motion on our client, and if it's appropriate to perform this on them anyway, we would want to ask our patient if they are in pain, and if so, then we would have them describe the pain and rate it on a scale of 1 to 10. Then we would explain to them that there will likely be additional pain as the joint is moved. So we would want to come to an agreed upon level of pain at which you will stop the movement and let them understand that you will stop that movement. So they, since they really have no control over how you're moving their joint because it's passively, it would give them a little bit of control in that situation. As you move the arm through the passive range of motion, or through the ranges, have the patient say or count out the levels of pain as you move their arm and as the pain increases. If and when the pain expresses that the agreed upon level of pain has been reached, then stop the motion and don't move it any further. That would really mess up the level of trust that they will have for you. If the patient does not indicate pain or is unable to communicate a level of pain with you, then you would perform the movement of the joint just to the point of resistance, and then you would stop and return back to a neutral position. So now I will demonstrate passive range of motion on a patient in sitting. So to demonstrate passive range of motion of the shoulder and the elbow, first you want to support the joints, so I'll hold my hand here on her scapula, as well as stabilize her elbow. So we would do elbow flexion, shoulder flexion, shoulder extension, shoulder abduction, shoulder adduction, there, bend your arm, there you go. Internal rotation, external rotation, horizontal adduction, horizontal abduction. Again, we're going to support the joint. Elbow flexion, elbow extension, pronation, supination.